Hello and welcome back to GP Video Podcast by Nadia. So, we had started talking about the Red Book of Royal Australasian College of General Practitioners, which is RACGP. What is Red Book? So, basically, it is widely accepted as the main guide to the provision of preventative care or preventive care in Australian general practice. So, this is the main guide for preventative practice in Australian general practice, and because general practitioners are the main contact or are the most basic contact or are the primary contact for patients, so preventative activities or screening procedures are best implemented in primary care and are best carried out by the general practice. So it says that widely accepted as the main guide to the provision of preventive care in Australian general practice, the Red Book is one of the most accessed resources produced by the RACGP. It provides a much needed and valued synthesis of the many aspects of preventive care relevant to our patient population. Okay, so this is all about preventative activities and screening. So the Red Book supports evidence-based screening, case finding, and preventive activities in primary care, covering primary and secondary prevention. So what is primary prevention? Primary prevention means preventing the initial occurrence of a disorder, which means that screening asymptomatic individuals if they have, risk factors, and secondary prevention, which means early detection of the disease and intervention. So Red Book actually really gives us resources about primary prevention, initial preventing the initial occurrence of a disorder, and then the secondary prevention, which is early detection and intervention. So it actually includes many health conditions like cancer, cardiovascular, development and behavior, genetics, infectious diseases, injury prevention, mental health care and substance use, metabolic, musculoskeletal disorders, reproductive and women's health, miscellaneous and men's health, and many other things. So we started off with cancer, and the first cancer that I spoke to you about was bladder cancer. And what did we find in bladder cancer is that bladder cancer, it is estimated that in 2023, more than 3,000 people were diagnosed with bladder cancer in Australia. Incidence and mortality of bladder cancer is approximately 3 to 4-fold higher in males than females. But in table of recommendations, we found that screening for bladder cancer in asymptomatic adults is not recommended because there is insufficient evidence to assess the balance of benefits and harms. So we do not screen the general population or the asymptomatic individuals. Basically, screening means looking for a disease in asymptomatic individuals. The people who are symptomatic then get managed, like they get diagnosed and managed. But asymptomatic individuals are the ones that we screen, so we can implement primary prevention, which is the prevention of initial occurrence of disorder. So bladder cancer screening is not recommended. Then the next cancer that I would like to start with you is the skin cancer. So let's just read about skin cancer. So skin cancer is basically of two types, melanocytic and keratinocytic or non-melanocytic. So melanocytes and non-melanocytes skin cancer. There are two types of skin cancers, melanoma and non-melanoma. Non-melanoma cancers include squamous cell carcinoma and basal cell carcinoma. So let's read about prevalence and context of this condition. So Australia has the world's highest incidence of skin cancer, unfortunately. Again, I would read this line again. Australia has the world's highest incidence of skin cancer. Skin cancer incidence and mortality means death rate, is higher in males than females. Melanoma, which is melanocytic skin cancer, is the third most common invasive cancer diagnosed in Australia. Invasive cancer means the cancer that actually invades, like goes deeper behind the main organ and then spreads in the body. So it is the third most common invasive cancer diagnosed in Australia, which is where I'm talking about melanoma. In 2021, an estimated 16,878 Australians were diagnosed with invasive melanoma, and a further 27,585 were diagnosed with a melanoma in situ. Melanoma in situ means the one that has not invaded as yet. Melanoma incidence is similar for males and females up to the age of approximately 45 years, but by age 80 years, the incidence is twice as high for males than for females. Melanoma incidence increases with age, but is disproportionately high among young adults compared to other cancers. And it is actually the most commonly diagnosed cancer for the age group 20 to 39 years. Once a person has developed a melanoma, they are at approximately 5 to 10 times higher risk of developing another primary melanoma, although personal risk varies according to the presence of different risk factors. So this was all about melanoma. Then non-melanoma cancers, which include basal cell carcinoma and squamous cell carcinoma, are also common in the Australian population. It is estimated that over 2/3 of Australians will develop a non-melanocytic cancer in their lifetime, and many people develop multiple skin cancers. Skin cancer is highly preventable through sun protection strategies. It is estimated that skin cancer related conditions account for approximately 3% of all health problems managed in Australian general practice. And this is higher in regional or remote areas and in areas associated with lower socioeconomic status. So this was prevalence and context of the condition. In my next video podcast, I would be talking about identifying risk of melanoma, and then we will also talk about table of recommendations and how do we screen general population for skin cancers.